After a Suicide, a webinar for school administrators. Presented by Gabriella Pelosi. The webinar will include a definition of suicide, myths associated with suicide, the explanation of the grief process, key interventions and resources, all for school administrators to help students cope. The first myth, talking about suicide or asking if someone is suicidal will encourage suicidal attempts. This is false. Talking about suicide provides an opportunity for open and honest communication and intervention. The second myth, teens are at the greatest risk for suicide. False. The elderly are at higher risk with loneliness and illness as top contributing factors leading to depression. The third myth, attempted or completed suicides happen without warning. Also false. It's likely the cause or intention of suicide was actually just missed. The fourth myth, once a person is suicidal, they will be suicidal forever. Thankfully, false. Given the proper assistance and support, people can live healthy and happy lives, never thinking of suicide again. What is suicide? Suicide is a complicated behavior. It is not caused by one single event. It is usually caused by an underlying mental disorder like depression or substance abuse. Suicide results in taking one's own life, intentionally or voluntarily. Helping students cope through the grief process. Grief is a very powerful emotion that is often triggered by death. It engenders feelings of helplessness and passivity. The grieving process is a series of behaviors and attitudes related to coping with the stressful situation of a changing in the status of a relationship. Students may experience tremendous grief after a suicide takes place at school. Typical stages of grief may include shock, denial, anger, confusion, despair, and rejection. So how can you help? Leadership team should include school counselors, nurse, a mental health partner, and be supported by adults and parents in the school community. Try providing students with appropriate opportunities to express their emotions and help identify strategies to manage them. For example, schedule meetings with students in small groups to facilitate discussion. Also try implementing practical coping strategies. Some of these include relaxation and distraction skills, like taking deep breaths, or engaging in favorite activities like watching a movie with a friend, journaling, exercising, or talking with people for support. And educate students about the warning signs and risks of suicide. A key suicide factor is an undiagnosed, untreated, or ineffectively treated mental disorder. Warning signs include talking about wanting to kill oneself, looking for ways to kill oneself, sleeping, isolating, or increased use of drugs or alcohol. Beware of suicide contagion. According to the American Foundation for Suicide Prevention, contagion is the process by which one suicide death may contribute to another. The increased attention and exposure can result in suicide and suicidal behaviors, especially for those who are at an increased risk. Students who may be at an increased risk for suicide include students who have a history of previous attempts, were an eyewitness to the death, or received a telephone call or letter foretelling the suicide. It's important to consider diversity issues when dealing with suicide. Students have different religious beliefs when it comes to death. Be sure to honor them. The LGBTQ individuals are at at an increased risk for suicide. And remember, male and females commit suicide in different ways. Be aware of these when dealing with students. For more information on suicide and how to best support students after a suicide at your school, visit the following resources. Thank you for participating in today's webinar.